Brought to you by Agilus Diagnostics.
Agilus Diagnostics.
Before we start with another episode of Doc Talk, don't forget to like, comment and share. Recent news of Hina Khan being diagnosed with stage 3 breast cancer has again brought attention to how common this disease is among women in India. According to the journal Cancer, breast cancer is the most common cancer among women in India. Early detection can make a big difference and help to ensure it remains highly curable. Look out for early signs like lumps, changes in breast shape, and unusual discharge. Even if diagnosed, breast cancer is one of the most curable cancers when caught early. In advanced stages, treatments can shrink tumors, slow growth, and improve quality of life. The effectiveness of treatment depends on the cancer stage, but there are always effective management options available. To know more about this in detail, we have an expert with us today.
Why is breast cancer increasing amongst Indian women? To answer this question, I, Dr. Divya Sehra, consultant Gynecology at Manipal Hospital, Dwarka, is here for you. Yes, breast cancer is the most common cancer globally and also amongst the Indian women, and it has surpassed lung cancer as the leading cause of mortality. Breast cancer is a hormone-dependent malignancy. That means that a lot of factors go into it. Because Indian population is sort of copying the West in terms of lifestyle, that means that children from the young age group have a lack of physical activity, tend to be obese, and they have a lot of PCOS, which is common in the adolescent period, and because of decisions of their life, as in delayed childbearing, delayed age of marriages, and even short or no breastfeeding at all, there is some contribution from all those factors. Also, when we talk about diet, a diet based in red meat and also some smoking, alcohol, and lack of a fiber-rich diet also contributes to this problem. Alcohol consumption has increased tremendously, and also smoking is a habit which we need to take care of. In the past, in 3 decades, we have seen that the breast cancer has increased over 50% in Indian women. It also depends a lot on the genetic factors. Only 10% of factors have actually a family history related to it. So you may find you or your relatives having this problem and not having a family history of concern. But definitely there are some genes which are involved, and it's a syndrome which involves the breast and the ovaries. Also, it is called the BRCA syndrome. There are other syndromes like the Lynch syndrome, where the uterine cancer, the colon cancer, and the breast cancer is tied together. That is why role of a geneticist gets important, and the history of your relatives, if they have breast cancer, any gene associated with it should be known. With the demand, there is a lot of supply that goes on. Because breast cancer is such a big problem, we also have a lot of screening methods, and development has taken place in that. So the Indian guidelines do not have their own production, but the US Task Force Prevention guidelines are being followed. Every woman after the age of 40 years should have an annual, that means every year they should have a mammography. Indian breasts tend to be dense, so there may be some high false positives in the mammogram, so sometimes an ultrasound breast is also overlapped with it. If you have a family history of concern or there is a genetic defect in the family, then MRI of the breast is also very important and should be done at frequent intervals. Apart from breast cancer, which is detected by these methods, there is also the concept of breast cancer awareness, where every woman should be aware of any sort of changes in the breast. It can be a lump, it can be a nipple retraction, it can be nipple discharge, or a lump in the armpit, which should totally be taken care of, and being cognizant of these factors is mandatory. The breast cancer treatment also has undergone a lot of changes. From the concept of having a surgery, which is very morbid, and giving only adjuvant chemotherapy, the changes have been advancement has been taken place in order to keep the women's self-image intact. like breast conservation surgeries, targeting the lesion and having different types of chemotherapy is now very prevalent. Immunotherapy, a lot of research has gone into that, and also gene profiling is becoming more and more popular. So be aware of your symptoms and please consult your gynae oncologist if you notice any lump, any discharge, any pain, or any armpit lump in your breast. Thank you.
So if you notice any of these signs, consult your doctor immediately and follow your doctor's advice. That's all for today. Keep watching Doc Talk on Fit Tak.